Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Today will be presented the skull anatomical features by the Dr. Osman Ahmad Osman, Department of Anatomy. This is the first part of this lecture. The main learning objective of this lecture is identify the individual bones which form the skull. In this lecture, we're talking about the bone forming the skull. Any parts of the bone forming the skull, and each part have features. The individual features of any part of the bone forming the skull describe in details and formally related to him. Also identify all bones of the cranium and the facial bone. Must be known the skull is forming from the cranial part and the facial part. The facial part forming the face bony part, and the cranial part found the brain inside of the skull. Also describe the different part of each individual bone, that including foramens, parts related to the important structure in the skull, may be related to skull outside or related to skull inside, like the brain structures. This is very interesting lecture and very important for the medical student or the dentist or any clinical person dealing with the skull, like the neurosurgeon or emergency medicine or the neurologist. The skull. The human skull is the bony structure and part of the skeleton. That means the human skeleton that is forming the head. The skull found in the head, which is a supporting structure for the face, because the face contains a lot of muscle. When talking on the lecture of the face, found the face is containing a lot of muscles that mean face expression. The face expression need also this muscle, or these muscles need to insert it in the bony part to forming the face structure. Also, this skull loading inside the brain, containing brain as a brain cavity, and working this skull as a brain side for the protection from the outside. In human, the adult skull is normally made of 22 bones. All the bones forming the skull will be joined together by the sutures. That means any bone joined to each other, that forming the joints. But this joint is immovable, except in the early of life, have a minimal movable features, especially during the passing of the head of the fetus or the fetus into the birth canal, forming by the after that need this skull will be growing, therefore not ossify. But after his growing of the child, all this suture will be fused and ossified as bony ossification. All this skull bone joining sutures not movable after his development of 2 to 3 years of child. Except the mandible, he is a joint connecting to the skull, TM joint. temporomandibular joint. The skull also contains the sinuses, and this is a sinus cavity is the alone lectures. You must know the sinus cavity is air-filled cavity lining by the respiratory epithelium, line the large airway. The respiratory epithelium lining the cavity or air-filled the cavity, same it is a part from the respiratory system. This have a one lectures and a lecture only talking about the sinuses. But it is mentioned here to understand is a part from the skull. In some books talking about to be a lighting of the skull. You can see here, this is the skull, bony part, and this is the part of the facial skeleton, and this is the cranium skeleton. The cranium skeleton inside found the brain, protecting from the outside. This is a mandible, and this is a TMJ joint, temporomandibular joint. This is the only joint movable in the adult skull. Also, this is the suture. You can see this is the sutures between the bones. To understand this skull well, you must know this is the outside part from the skull named as precranium, and the inside part also known as endocranium, and the in between is the dubble. The endocranium is a more pretty for the fracture, but is the outside precranium is a very hard, not fracture easily. The debut and the precranium and endocranium will be some connection by the foramens and some imaginary veins penetrating this bone for connection between the venous part inside the brain and the outside of the skull. The debut is a forming from the compact bone and in histological features or component. The framework of the skull is a two-part single bone and the pairs bone. The single bone is a frontal, occipital bone, sphenoidal bone, ethmoidal bone, vomer, and the mandible. This is only as single bone. Only one bone forming as a one unit. Also, the pairs bone is a mean of the two parts. The same bone have a two parts in the skull, identical in shape and structures. They like parietal bone, the two temporal bone found in the right side and the left side of the skull, zygomatic bone, one on the right side and one on the left side, nasal bone, lacrimal bone, found in the orbital region or the orbital cavity. In the right orbital cavity, one is a lacrimal bone. In the left orbital cavity, found another lacrimal bone. And the maxilla, forming the cheeks. And the inferior concha found in the nasal cavity. These are pair bones, two bones in the skull. But the single bone is the one only one bone found in the skull. Also the palatine bone, the two palatine bone, between them found the suture, forming the hard palate of the skull. The roof of the oral cavity. You can see this is the skull and this is separated bone from each other, you know to identify these structures separately. You can see this is a frontal bone. This is the frontal bone is a single bone, is the only one bone. This is the parietal bone, is a two parietal bone, pairs bone. This is the temporal bone, this is a two temporal bone. This is occipital bone, and this is a sphenoid bone. You see, this is occipital bone is a one bone, and the sphenoid bone is like the wing here. This is the only one bone. Also, you can see this is a nasal bone, and this is a nasal bone, and this is the ethmoidal bone. This ethmoidal bone is the only one part. This is the lacrimal bone. You can see this here is a lacrimal bone. Also at the another side, the lacrimal bone, but not will be seen in this view. This is the concha, inferior concha, the one in this side and the another in the another side, but you cannot see here. This is a vomer, only one bone, vomer, the nasal cavity. This is a zygomatic bone, and this zygomatic bone. This is a mandible, only one bone, but is a zygomatic is a pause or paired bone. This can define the parts of the skull. In this view, you can define some part of the bones to be familiar with the bone of the skull. You can see this is what is name of this. This is a frontal bone found frontally from the front. This maxilla is maxilla bone. This is a maxilla bone forming the upper teeth part, the maxillary teeth above, and this is a mandible forming the lower jaw and the lower teeth. This is a zygoma. This is sphenoid, and also this is a sphenoid. You can see this is a lacrimal bone, and this is a nasal bone. This is inferior concha. This is a nasal septums, and this is the vomer. You can see this is a part of the parietal bone here, and this is a parietal bone here. This is a temporal bone here, and this is a temporal bone here. This is the orbital cavity on the right side, and the left orbital cavity is one of the nasal bone on the left side of the orbit, and this is the right side orbital cavity. They found the right lacrimal bone. This is a nasal bone. Is also frontal, and this is a nasal, this is a maxilla, and this is a mandible, and this is the inferior concha. Is in the lateral view. You can see is a frontal bone also, parietal bone, temporal bone. Is known as the zygomatic arch part. All this is a zygomatic arch. Sphenoid bone. This is the orbital cavity, and this is the part of the nasal cavity. This is a mandible, maxilla, zygoma, is a lacrimal bone, occipital bone. You can see this is a lacrimal bone here, the parietal bone, the occipital bone, temporal bone, zygomatic bone. This is a lateral view, but you do the sagittal section to see inside the skull. You can revision of the important part. You can see this is a frontal bone from the inside, the frontal bone, and this is a parietal bone. This is occipital bone, same, and this is a temporal bone, and this is sphenoid. You can see this irregular shape of the bone. This is sphenoid, and this is sphenoid sinus. Okay, this is sphenoid sinus, and this is the area of the pituitary, lodge of the pituitary, sella turcica, and this is a nasal bone. You can see an inferior concha. Okay, this is a ethmoidal bone. This is ethmoidal bone. And this is the cribriform plate of the ethmoidal bone. This is a maxilla. You can see how you know this is a maxilla because it's the upper teeth. I found the upper teeth, and this is the palatine bone. Yes, this is the palatine bone. This is the vomer. This is the vomer. Also, you can see this. This is apart from the sphenoid bone. This sphenoid bone is, and also this is a part of the sphenoid bone. This is ethmoid, and this is sphenoid. This is the inferior view of the skull. You can see this is the maxilla. How you know this is the upper teeth or the upper jaw, and this is zygoma, and this is a temporal bone, and this is a occipital bone. This is sphenoidal bone, and this is a vomer. You can see this opening, the foramen magnum in the occipital bone. Also, it is a lot of opening and foramen will be known when we need to ask and talking about this foramen in details. You can see this is a palatine bone, and this is a vomer. The hard to see from the front or the lateral side. To understanding of the knowledge of the skull must be know this is the part of the skull to be classified by the anatomist to understanding and revision easily. Therefore, divided to the norms of the skull. Divided the skull to the norms of the skull. Like this, you can. The norma verticalis, that is the view of the skull from the above. If you need to see the skull from the above, you can find something. Bones, sutures, structures, foramen. Also, the norma frontalis, we need to see the skull from the in front, facing you. Also, norma lateralis, even the right side or the left side, you see the skull from the one side and describe the structures of the bone and foramens and sutures. Also, norma occipitalis, you facing the back side of the skull or the behind, the skull from the behind. And the norma basalis externa, that means that see the skull from inferior view. If you're taking the skull and see from the inferior, this is the view, and this is the external or the outside structure found in this region, including the bones, sutures, and foramens. Also, the norma basalis interna, when the open the skull, the vertex of the skull, or the upper cranium part of the skull, and see inside the skull, the area of the sitting of the brain and the brain structure of the central nervous system. To memorize this, I putting something to memorize like this. You can concentrate in this part, this red star. First, when you talking about any view, first, when you see the skull and started to the describe, mention the name of the view, mention the bone found in this view, features of the bone in this view, sutures between the bones in this view, foramen and the structure pass through this foramen in this view. To remember this any norma features or normas of the skull. Can you follow this? You can memorize every part of the skull. You ask, what is this type of the norma of the skull? This is a norma verticalis. You see from the above. This is a norma verticalis. The first question to you, the name of the view, this is the norma verticalis because I see this skull from the above. What is the bone found here? Yes, this is the frontal bone, this is the parietal bone, and this is the occipital bone. Features of the bones. You can see here is the parietal eminence. This is known as a parietal eminence, and this is the parietal eminence. The farthest point in the skull laterally. This is the parietal eminence. Also, sometimes this is the frontal part or the frontal eminence in some box. You can see another things. Yes, these are sutures. Also, sometimes you can see this here, but I need to talking about this in the lateral view. Is a superior temporal lines if found and inferior temporal lines is a better to see in the lateral view. You can here see this is a suture. This is a suture found in the coronal between the frontal and the parietal, two parietal bones. Okay, this name is a coronal suture. Therefore, is defined the coronal suture is a suture between the frontal bone and the two parietal bone. Also, this is a sagittal suture. The sagittal suture is a suture found between the two parietal bone. And the lambdoid suture is a suture found between the two parietal and the occipital. Also, the point of the meeting of the sagittal suture with the lambdoid suture is a lambda. This is the area. Name is a lambda. Okay. This area in the pediatric or infant, you can know is the posterior fontanelle, and this is the area known as anterior fontanelle. But now is a fusing, because in the infant, after birth to 2 years, it was opening to for the growing of the brain of the child and the skull. The foramen and structure passing, you can see here, this is small foramen, parietal foramens, that is for the imaginary veins connecting between the scalp veins, external veins in the scalp and the inside. The main structure here related to the sagittal suture is near him, more than laterally, at the 1 centimeter, is the superior sagittal sinus. The superior sagittal sinus found here. What is the above directly, but is the more lateral, mainly, is a superior sagittal sinus. You can see here, this is a frontal bone, the parietal bone, and this is a parietal bone, and this is occipital bone. This is the coronal sutures between the frontal and two parietal. This is the sagittal sutures between the two parietal bone, and the lambdoid sutures between the two parietal bone and the occipital bone. Also, you can see this is a parietal foramen, this small parietal foramen. This small parietal foramen for the imaginary veins. Imaginary veins is a small veins connecting the internal or inside veins with the outside veins. Inside veins with the outside. Inside, I mean the veins of the brain. That means of the sinuses. When talking about the brain structure, you know the sinuses. The sinus found inside the skull. But the outside, they found part of the systemic venous circulation. What is this view? This is a norma frontalis. Norma frontalis. You can facing the skull from the anterior front, from the in front. This is the name of the view, norma frontalis, because I see the skull from in front. And this is the bone found in this. You can memorize. What is this? Frontal bone, nasal bone, the nasal bone, maxilla bone, oblique of the teeth, zygomatic bone for the chicks, two zygomatic bone, sphenoid bone. You can see this sphenoidal bone in the orbital cavity, and this is a lacrimal bone. Yes, this is a part of the frontal bone. This is the inferior concha bone. This is a superior concha, but is a cartilage, and from covering by the cartilage and part of ethmoidal bone. This is the vomer forming part of the septum. This is an important part of the anterior or the norma frontalis. You not forget this is a mandible. This is a mandible part. You can see what is the feature of the bone C here. The important feature, can see this is a mandible, is also we're talking about details in the end of this lecture, but you can see this is the angle of the mandible, and this is the ramus of the mandible, and this is the body of the mandible. Ramus, angle of the mandible, and the body of the mandible. Also, in this region found the bregma. Bregma is the not completing fusing of the frontal bone, because in the infant period and child, this not well fused and will be fusing with age, with aging process to be ossified. Also, in this region, you can see this alveolar process of the maxilla, and this is the alveolar process of the mandible. This is a zygomatic process of the frontal bone, and this is the frontal process of the zygomatic bone, forming the margin of the orbit. Sutures. You can see this is a suture between the two nasal bone. What is the name? Is intranasal suture between the two. Okay, this suture between the nasal bone and the maxilla. You can name the maxillary nasal suture or nasomaxillary suture, because it's between the nasal and the maxilla. Also, this is between the zygomatic and the maxilla. That means of this suture name zygomatico-maxillary suture. Zygomatico-maxillary suture. This is my zygomatico-maxillary suture. Okay, these are important sutures. Can you see here? This is the coronal suture, but is not part on the anterior view. The coronal suture because it's between the frontal and the parietal bone. The foramen can see here this supraorbital foramen and this is the infraorbital foramen. The supraorbital foramen passing of the supraorbital nerve and supraorbital artery and vein. Also, this is the optic canal. This is the optic canal found inside the orbital cavity. This pass of the optic nerve and the ophthalmic artery. The optic nerve is the cranial nerve number 2, responsible for the vision. Also, you can see here, this is a superior orbital fissure and the inferior orbital fissure. Okay, this superior orbital fissure and the inferior orbital fissure. In the superior orbital fissure, you can see the passing of the ophthalmic vein, ophthalmic nerve. Ophthalmic nerve is a branch from the trigeminal nerve, cranial nerve number 5. The first division is the ophthalmic nerve, is the sensory. Also, the pass of the oculomotor nerve, cranial nerve number 3, trochlear nerve, cranial nerve number 4, and the abducent nerve, cranial nerve number 6. And some sympathetic fibers came with the internal carotid artery from the sympathetic plexus around the internal carotid artery. Therefore, the superior orbital fissure contained the ophthalmic vein, ophthalmic nerve, oculomotor nerve, trochlear nerve, abducent nerve, and sympathetic fibers. Also, this is the inferior orbital fissure. In the inferior orbital fissure, you can see the inferior ophthalmic vein, the inferior ophthalmic vein. The infraorbital foramen pass, that means of the infraorbital fissure, this is the infraorbital fissure, go to reach the infraorbital foramen, and this is the content of the inferior ophthalmic vein or the infraorbital vein and the infraorbital artery and the infraorbital nerve. The infraorbital nerve is a part from the maxillary nerve, branch from the trigeminal nerve. Also, this is a mental foramen, contain the mental nerve is a branch from the mandibular nerve, branch from the mandibular nerve, branch from the trigeminal nerve. Also here, you can find this zygomatico-facial foramen, contain of the zygomatico-facial nerve and zygomatico-facial artery and vessels. Artery, when talking about the vessels, mean there is the artery and the accompanying vein. This is a nasal cavity, contain of the nasal part of the, this is talking about this in the separated lecture. Also, this is the orbital cavity, also talking in details in the separating lectures about the orbital cavity. Also, you can see this is opening here in the nasal pond. This is the opening for the nasolacrimal duct. This is a nasolacrimal duct opening, passing of the nasolacrimal duct, passing of the tears from the here medial side of the eye to the inside of the nasal cavity, mainly inferior to the inferior concha, meatus inferior to the inferior concha. You can see here, this is a frontal bone. This is the glabella or the bregma. Also, this is a superior orbital foramen or the notch for the passing of the superior orbital nerve and superior orbital vessels. This superior orbital fissures, and this is the inferior orbital fissure. Also, this is the optic canal. When talking about the optic canal, you must know passing the optic nerve and the ophthalmic artery. But you must be remember the optic nerve, the only nerve covering by the three meninges, bia, arachnoid, and the dura. And these meninges also pass through this foramen. Therefore, if you're talking about the optic canal structure pass, must be mentioned the dura, arachnoid, and the bia. Also, even the CSF passing in the subarachnoid space. Also, this is the nasal bone, and this is the maxilla, this is zygomatic bone, and this is the mandible. This is the part of the ethmoidal bone. This is part of the ethmoidal bone. Is a perpendicular plate. This is the part of the septum, medial septum of the nasal cavity. Talking about this in details in the nasal cavity lecture. This is the infraorbital foramen connecting the infraorbital fissure, and this is the structures. These zygomatic bones, but not mentioned here. This zygomatico-facial foramen. The lacrimal bone is the part of the ethmoidal bone. Okay. This is internasal sutures. Also, this is a mandibular symphysis. Yes, this is a mandibular symphysis region. Also, this picture I giving you to revision and see the details, because every lectures, every pictures in this lecture have a more details from the different sources. You can see this is the orbital cavity, and this is a nasal cavity, and this is the oral cavity when the open is jaw. You know, this is the ramus of the mandible, this is the body of the mandible, this symphysis menti, and this is a mental foramen for the passing of the mental nerve. This is the alveolar process of the maxilla. This is the alveolar process of the mandible. This is the mandibular teeth, and this is the maxillary teeth. This is the inferior concha. This is the vomer. This is part of the ethmoids. Also, this is a part of the ethmoids. This is a nasal bone, lacrimal bone, sorry. This is a lacrimal bone, and this is the nasal bone, and this is the maxilla. And sometimes this part is known as the frontal process of the maxilla. This is the frontal process of the maxilla, and this is the frontal process of the maxilla. And this is supraorbital foramen, and this supraorbital foramen, and this is supraorbital margin, and this is zygomatic process of the frontal bone, and this is the frontal process of the zygomatic bone. This is the infraorbital foramen connected to the infraorbital fissure, and this is supraorbital fissure. This is the optic canal. You can remember the bones from this is the key here to revision the parts and bones. You can see here this is the frontal eminence. Sometimes this is a supraciliary arch, the supraciliary arch, superior orbital margin, and the superior orbital margin. This is all the part of the frontal bone. This is anterior view, norma frontalis. In this view, see from the one side or the lateral side of the skull, the normal lateralis, right side or the left side. The name of this view is a normal lateralis. The bone you can see in this view, you can talking alone. You can see here, this is the frontal bone, nasal bone, lacrimal bone, maxilla bone, mandibular bone, zygomatic bone, temporal bone, sphenoidal bone, parietal bone, occipital bone. Is a bone found in this view. Features of the bone, you can see in feature in this view. Yes, this is the superior temporal line. This line you can see, this is a superior temporal line, and this another line is the inferior temporal line. This inferior temporal line, and this area will be came to talking separately in the lecture is a temporal fossa. This is a temporal fossa, contain a lot of structures. The important structures is the muscle temporalis muscles. When you close the jaw and putting your hand in this region, you found and feeling the contraction of the temporalis muscle. Now you can close your jaw hardly and putting your hand in this region, you found is the hard area. That means a contraction of the temporalis muscle, and this is the content of the temporal fossa. The fascia covering the temporalis muscles is the inserting in the superior temporal line. Also, the muscle itself, temporalis muscle, will be here attached to the inferior temporal line. Also, in this region, found the H shape area. This is a suture of the coronal suture and the frontosphenoidal sutures and the temporosphenoidal sutures and the temporal suture or barytosquamous sutures. This suture do the H shape here, and this is the area is the weakest area in the skull. If any hard trauma or by object or even the boxing very hard in this region will be fracture in this bone, easily fracture, and this fracture of this bone lead to the extradural hematoma. Extradural hematoma. This is a top emergency procedure doing by the neurosurgeon to evacuate this extradural hematoma. The extradural hematoma, because the middle meningeal artery came here and give the anterior branch and the posterior branch. Any fracture in this region can be lead to the cut of this, or even the fracture from the bone. This bone can be bleeding, and this lead to the accumulation of the hematoma in this side and compress the brain. And this is the arterial bleeding, or even the bone bleeding is accumulated and compress the brain and lead to death of the patient. This is important of this region. This is a pterion area. Known its name is a pterion. P is a silent. You can see sutures. You can name this suture easily. This is a coronal suture. This is a frontosphenoidal suture. And this is the sphenoid and temporal sutures. This is some features of the bone. Also, you can remember this zygomatic arch. the zygomatic arch forming between the zygoma and the temporal part. And this is a temporal part known as the squamous part of the temporal bone. This is squamous part of the temporal bone. And this is styloid process of the temporal bone. This is styloid process of the temporal bone. This is a mastoidal process of the temporal bone, area of the attachment of the sternocleidomastoid. From his name, sternocleidomastoid, that means sternocleidomastoid is the connecting to the sternum and the clavicle and the mastoid. This is a mastoid process of part of the temporal bone. Therefore, this is a temporal bone now. You know this is the squamous part of the temporal bone. This is the forming of the zygomatic arch. And this is the external auditory meatus for leading of the external ear. And the styloid process. And this is the mastoid process, area of the attachment of the sternocleidomastoid. Also, the styloid process, area of the attachment of the lot of muscles. Stylohyoid muscle, like this. Stylohyoid ligament. Okay. When talking about the pharynx, you can see these muscles and attachment. Also, this is what is the name of this suture? Lambdoid sutures between the parietal and the occipital. This is a masto-occipital sutures. Masto-occipital suture. Or the occipitomastoid sutures, another name. This is a mandible. This is a ramus of the mandible, and this is the angle of the mandible, and this is the body of the mandible, and this is the mental foramen. This foramen you can see here must be known the zygomatico-facial foramen. This foramen was the external auditory meatus, the end by the tympanic membrane for the hearing. This important foramen here you can see is a mental foramen crossing the mental nerve. You can see this picture, same, but the another side. This is the Terrian region. This is the area of the bregma. You see, this is the top of the skull, connecting between the coronal suture and the sagittal suture. And this is the lambda, connecting with occipital lambdoid suture with the sagittal sutures is the lambda. This area of the sterion. This is the temporal fossa. This is superior temporal line. And this is inferior temporal line. This region is the infratemporal fossa, but must be the remove first the zygomatic arch. This is the zygomatico-facial foramen, passing of the zygomatico-facial nerve, the zygomatic arch. This is a temporomandibular joint, loading of the condylar process of the mandible. This is a condylar process of the mandible. And this is the ramus of the mandible, and this is the notch of the mandible. And this is the angle of the mandible. This is the body of the mandible. This is the mental protuberance of the mandible. This is the lacrimal bone here. This is the lacrimal opening. This is the nasion. This is the glabella, non-fusing part between the two frontal, or the even this suture forming between the two frontal bones. This is external acoustic meatus, and this is the mastoid process, and this is styloid process. Styloid process. Also, this same picture for the revision, you can revision this part of the bones of in this view. You can see here to see the infratemporal fossa. I remove the zygomatic arch. Zygomatic arch formed by the part from the temporal bone and the zygomatic bone will be removed, and this area known as infratemporal fossa, I will be talking about him in separating lecture with the temporal fossa. This lecture name is the temporal and infratemporal fossa. This triangle shape is a trigopalatine fossa. Or trigopalatine fossa. This is a trigopalatine fossa is another region found a lot of opening for the passing important structures go to inside the skull and the oral cavity and the nasal cavity and the inside infratemporal fossa inside the brain, inside the skull, with the brain found. This all can go from this infratemporal fossa, but is it not is a triangle? This is a trigopalatine fossa. It's a trigopalatine fossa. And this area is the infratemporal fossa. This area is the infratemporal fossa. The above is the temporal fossa. This is a temporal fossa. You can see this is a blue shape. This is a trigopalatine fossa. Talking about him in the separating lecture. This is a lateral pterygoid blade of the sphenoid bone, and this is the humulus of the lateral pterygoid. Here you remove the zygomatic arch from the zygomatic bone and the temporal bone. You can see this trigopalatine fossa found anterior to the lateral pterygoid in the posterior margin of the lateral pterygoid and the posterior margin of the maxilla. Between them, you found the trigopalatine fossa. It's a very important region in the skull. This lateral view X-ray to understanding some structure in the X-ray view. This is a frontal sinus. You can see this frontal sinus. Any plaque side inside any plaque, that means is a feeling of air. Also, this is a maxillary sinus. Maxillary sinus. The ethmoidal sinus. This sinus is found in the bony, therefore named by the same bone. This is the frontal, named the frontal sinuses because it's found in the frontal bone. Maxillary sinus found in the maxilla. You see these upper teeth, therefore called the maxillary sinus. This ethmoidal air cells is found in the ethmoidal bone, the anterior cranial fossa. This is sphenoidal bone. You can see this is the sella, this area of the sella, and this is the sphenoid sinus. You know, this is the occipital bone, very thick part, squamous part of the occipital bone. This is mastoidal. If you remember, the mastoid bone is a part of the temporal bone, the mastoidal air cell. We'll stop here and thank you for listening, and must be learning more about the skull feature was mentioned. Will be continue in the second part of this lecture.